There are 3 stages to menopause: perimenopause, menopause itself, of course, and postmenopause. The clinical definition of menopause is when a woman's menstrual period stops completely and for a minimum of 12 months straight. It signals the end of the ovaries releasing eggs for fertilization. Menopause generally occurs between the ages of 45 and 55, although it can occur as early as the 30s or as late as the 60s. It can also result from the surgical removal of both ovaries as well as from chemotherapy treatment. But just prior to menopause, throughout perimenopause, a woman may begin to experience physical and emotional signs and symptoms such as hot flashes and depression, even though they still menstruate. The average length of perimenopause is about 4 years, but for some women, this stage may last only a few months if she's lucky, and in others, it may continue for up to 10 years. Changes in symptoms of menopause include a change in menstruation, where periods may be shorter or longer, lighter or heavier, with more or less time in between. Hot flashes, of course, and night sweats, trouble sleeping, vaginal dryness, mood swings, trouble focusing, and less commonly, hair loss on the head, but increased hair on the face. About 85% of women experiencing menopause will have hot flashes. During postmenopause, when a year has passed since the last menstrual period, women are at a higher risk for developing osteoporosis, which is of course bone loss, as well as heart disease. This is all due to the decrease in circulating estrogen. Calcium is the nutrient consistently found to be the most important for attaining peak bone mass and preventing osteoporosis. Adequate vitamin D intake is required for optimal calcium absorption. Adequate calcium and vitamin D are deemed essential for the prevention of osteoporosis in general and are key natural health products to prevent postmenopausal osteoporosis. Sage, or Salvia officinalis, contains compounds with mild estrogenic activity. In theory, estrogenic compounds may decrease menopausal symptoms. Sage has been tested against menopausal symptoms with promising results. Soy products containing isoflavones have also been studied for the reduction of menopausal symptoms such as hot flashes. And black cohosh, as many of you have heard of, otherwise known as acetoracemosa, is a popular alternative to hormonal therapy in the treatment of menopausal symptoms, which also include hot flashes, palpitations, and mood disturbances.